Good afternoon, everyone. My name is Angelina, and I'm a graduate student worker for Livewell Schools within the Health and Human Services Agency at the County of San Diego. I'm excited to be giving this presentation today with my fellow Livewell Schools graduate student workers, Olivia and Ariana. We are excited to share more information with you today about Livewell Schools. First, I would like to provide some brief contextual information about San Diego County. In San Diego County, we are 4,261 square miles. This is larger than 21 of the US states and roughly the same size as Connecticut. We are the fifth largest US county and the second largest within the state of California. We include 18 municipalities, 36 unincorporated towns, and 18 tribal nations that are home to approximately 3.3 million people as of 2020 estimates. We are a very diverse region with over 100 languages spoken, a large military presence, the largest refugee resettlement site in the state, and the busiest international border crossing in the world at the San Isidro, Mexico border. Regarding our schools, the county includes 43 school districts that served 478,175 students during the 2023-2024 school year. Given the large geographic and population size and diversity of our county, Livewell Schools serves as an important initiative of the county's HHSA, and we are an integral part of Livewell San Diego, the county's dynamic vision to create a healthy, safe, and thriving region. Livewell San Diego strives to make a collective impact by partnering with organizations. Livewell Schools accomplishes this effort by recognizing that schools and school districts are key partners in creating healthy environments for children. We support a dynamic vision for healthy, safe, and thriving schools by one, providing data and resource connections to decision makers within school districts, and two, building and strengthening partnerships between organizations and schools. As a team, we strive to first build and strengthen relationships between all relevant individuals to address health disparities among children in San Diego County. And second, support healthy school environments, recognizing that children's health behaviors are influenced by the opportunities available in the places where they spend most of their time, like school. And last but not least, collect and share data to better understand how student health and success are affected by chronic absenteeism, local control and accountability plans, and local school wellness policies. Next, I will review our objectives. Our first objective is to have all school districts in San Diego County recognized as partners of Livewell San Diego. To date, there are more than 570 Livewell San Diego recognized partners, including 40 out of the 43 school districts within the county. We're not calling the remaining 3 out by name, but they're all in various stages of communication about becoming partners. And in fact, there may be 41 very, very soon. Further information about how to become a Livewell San Diego recognized partner is available at this link if you're interested. Our second objective is to foster collaboration between the San Diego County Office of Education, also called SDCOE, HHSA, and other partners with a focus on community schools. The California Community Schools Partnership provides grants to schools and districts to realize their own vision of becoming resource hubs within their communities. There are more than 140 schools and districts that are community school grantees within the county. On this slide, there's a video created by SDCOE and HHSA that highlights the unique alignment of these two large agencies. This past May, our first joint Community Schools Network meeting was held with over 200 attendees. The HHSA departments that presented at this meeting were Behavioral Health Services, Child and Family Wellbeing, the Office of Homeless Solutions and Equitable Communities, Public Health Services, and Self-Sufficiency Services. Here is an example of the power of partnerships from the Community Schools Network meeting that happened this past May. Our Livewell on Wheels bus came to the event to show attendees how county residents can access a variety of services just by visiting the bus. Feedback about this event was very positive, and we have begun regional meetings since then. Our first regional meeting was held on September 11th with staff from community schools located in the 5 South County school districts, HHSA staff, and other regional key partners. And we plan to continue holding these meetings for additional regions in San Diego County in the near future. This will be the fifth year that Livewell Schools and SDCOE have co-hosted the annual summit on student engagement and attendance at the Livewell Advanced Conference. Last year's summit broke attendance records with more than 300 of the 2,000 advanced attendees registering for school summit breakout sessions. There was a school superintendent's breakfast as well, and 9 breakout sessions with 15 presenters. This year, we also plan to include a session for community schools to network with each other. Come join us on November 21st at the San Diego Convention Center if you're interested in this event. Our third objective is to analyze data and identify trends. By sharing results with school districts and other collaborators, efforts can be made to create healthy school environments for students to learn, grow, and reach their full potential. Here's an image of our Livewell Schools infographic, which demonstrates how greater student attendance can be supported by strong wellness policies, which is funded through the LCAP. We will further dive into each of these 3 focus areas later on in the presentation. And next, Olivia will dive further into our work to support student wellness.
Thank you so much, Angelina, and good afternoon, everyone. My name is Olivia Kellerman, and I'm also a graduate student worker here with Livewell Schools. At Livewell Schools, we have 3 main focus areas when considering connections to student wellness: LCAP investments, wellness policies, and chronic absenteeism rates. First, we analyze how the designated student health and wellness spending outlined in the school district's LCAP investments are distributed over 3 categories. As you can see, in the last year, we found that 9.2% of student health and wellness funding was for student safety, 46.8% was for physical health, and 44% was for social and emotional health. Second, we look at school districts' wellness policies and give them a score based on strength and comprehensiveness of the policy's language. Lastly, we analyzed chronic absenteeism rates in San Diego County and found that more than 114,000 students missed 10% or more of school days in the 2022 to 2023 school year. To paint a more complete picture, our first focus, wellness policies, highlights the importance of policies that support student health and well-being in schools. We provide this infographic to school districts to give them a better understanding of wellness policies, why they're important, and how we can help or guide them towards strengthening their policies' language and the resources that may help them implement their policy further. When considering the data, we calculate 2 scores for each district. The overall comprehensive score, or how in-depth the policies are, increased from 52 points in 2015 to 78 points in 2024. The overall strength, or how strong the language in the policy is, increased from 30 points to 56 points. The collaboration between the partners of the COI schools and after-schools domain have supported districts to continue strengthening wellness policies in San Diego County. We hope to see these policies get stronger over time to help with our collaborative partners. In this graph, you can see that most schools updated their wellness policies from 2017 and beyond, with only 5 having their most updated version from 2013 or 2015. We encourage school districts to update their wellness policies, as the more updated policies tend to have met federal and state requirements and include stronger and more comprehensive language, which resulted in higher WellSat 3.0 scores. Now, Ariana will discuss the remaining 2 focus areas.
Hi, everyone. I'm Ariana, and I am a graduate student worker with the Livewell Schools team. The second focus area that Livewell Schools covers is the Local Control and Accountability Plans, which we call LCAPs for short. LCAPs are a 3-year budget plan for all local school districts that outlines goals, actions, services, and spending aimed at supporting positive student outcomes, especially for students with greater needs, such as English language learners, low-income students, and foster youth. LCAPs are critical because of a child's place significantly impacts their health and well-being, and children spend a majority of their time in school. This is why it is necessary to invest in the creation of healthy schools as places where children can thrive. This figure shows the breakdown of the 18% of action items in all 42 district LCAPs that were itemized as fitting into one of the three main itemized health and wellness categories. These categories include physical health, social emotional health, and safety. Out of the total itemized health and wellness spending and non-health and wellness spending, physical health and social and emotional health share the highest percentage of health and wellness itemized spending at 8%, while safety is slightly lower at 2%. The blue area, which we can see is clearly the majority of the chart, displays 82% of the non-health and wellness LCAP spending, meaning these investments do not fit into any of the three health and wellness categories. This slide shows the categories and subcategories in which each goal and action within an LCAP will be placed. Each category has subcategories that address additional specific areas within that category, and we use these categories and their subcategories to decide where each goal and action within an LCAP will be placed. Itemized spending is strongly recommended and encouraged by Livewell schools. Itemized spending means a specific dollar amount was entered for a clearly identified action. If an item is not itemized, it means the LCAP lacks essential information on specific spending. Districts are encouraged to provide more transparency and clarity in budgeting by itemizing spending for each action item. This provides a better picture of how much money is spent on specific actions to achieve district goals. If an item is itemized, it means that the LCAP analysis provides an accurate picture of how the district spending is categorized. The graph on the right shows the health and wellness itemized spending in each of the three categories. In the 2022-2023 school year, out of the total health and wellness itemized spending, physical health constituted 46.8% of spending, with social and emotional health closely behind at 44% and safety at 9.2%. The third focus area that Livewell Schools covers is chronic absenteeism. In California, chronic absenteeism is defined as a student missing 10% or more of enrolled school days, excused or not. Consistent absences can lead to a breakdown of positive learning condition, further impacting a student's lifelong academic success. There are many individual and external factors that can contribute to chronic absenteeism, but certain student subgroups have generally higher rates. These student subgroups include youth in foster care, youth experiencing homelessness, students with disabilities, and English language learners. As described earlier, place has a significant impact on well-being. Therefore, it is essential that adults create schools where children can thrive and feel that they belong, further encouraging these students to attend their classes no matter their circumstances. This is a graphical comparison of regional averages for the total chronic absenteeism rates by school year, with green representing the 2021-2022 school year and orange representing the 2022-2023 school year. We can see that the chronic absenteeism rates decrease across all regions in San Diego County from school year 2021 to school year 2022 to school year 2022 to 2023. It is important to know what students are missing so much school. The chart here shows the compiled chronic absenteeism rates for all 42 school districts in San Diego County, divided by specific student subgroups for the 2022-2023 school year. The sections highlighted in yellow in the San Diego County average column indicate that the student's subgroup has a chronically higher absenteeism rate than the California average, which is concerning. Now, Olivia will introduce the Livewell Schools map.
Thank you, Ariana. So the Livewell School map pinpoints what HHSA programs and services are placed in the schools and school districts of San Diego County. The purpose is to build and strengthen the relationships between schools, districts, HHSA staff, and community partners in order to more adequately meet the students' needs and bring us closer to our overall goal of health equity for all children in San Diego County. There are 34 HHSA programs in San Diego County, and you can use the map to explore the programs at each and every school in the district of San Diego County, or connect with HHSA staffs to bring new programs to your school or district. One of my favorite things to do is look at my local school district and see what programs are offered and which are not offered, and kind of see what we can improve on in my local school district. So lastly, we have our Tools for Schools resources database, where you can go ahead and search for all different resources that we found available in San Diego County. And you can find that on our website at Live Well Schools. And you can also click this link on our presentation. And it's just a really easy and low-cost way to share resources with our local school districts and help them with both immediate needs and long-term needs. Thank you so much for listening to our presentation. Please feel free to reach out to any of us or our supervisor, Pam Smith, with any additional questions. Thank you.